Today on Investigate TV, some patients report possible rare side effects from injectable weight loss drugs. We look into reports to the FDA.
I know without a doubt that it made me violently depressed.
Plus, firefighters face an unexpected killer, sudden cardiac events.
My oldest son texted me and said, Dad's cold and not breathing.
And full disclosure on mandated medical certificates has some pilots worried they'll be grounded.
The evolving data suggests that a large population of pilots may participate in healthcare avoidance.
Investigate TV starts right now. Hello and welcome to Investigate TV. I'm Lee Zurich. New weight loss drugs are so effective and so popular, pharmaceutical companies can't make them fast enough to meet the demand. But now the Food and Drug Administration is investigating rare reports of depression and suicide from people who took Ozempic, Wegovy, and a class of similar drugs. Brendan Keefe has a story of one patient who reported his attempted suicide to the FDA.
Clint Etheridge has taken steps to defeat his twin enemies, diabetes and food addiction. His doctor prescribed semaglutide, the active ingredient in Ozempic and Wegovy.
It does something miraculous to your brain and your sense of satisfaction and fullness and your whole thought process.
You lost about 70 pounds.
Yes.
That's extraordinary in a year.
Yes.
The photos tell the story before and after. His diabetic numbers melted away with the pounds.
The drug worked.
Yes.
So what went wrong?
I know without a doubt that it made me violently depressed. I didn't want to believe it was the drug. Frankly, I wanted to remain on it and thought I might stay on it for life, but it just got progressively worse, and it led to a suicide attempt.
The FDA has approved two injectable versions of semaglutide, Ozempic for diabetes and Wegovy for obesity. Both contain the same active ingredient that leads to weight loss, and both have 15-page prescribing information sheets. For Wegovy, prescribers are told to monitor their patients for depression or suicidal thoughts and discontinue if symptoms develop. Depression is mentioned 5 times in the Wegovy prescribing information, and the word suicidal appears 14 times. But for Ozempic, the words depression and suicidal appear nowhere in the prescribing information. Novo Nordisk has the exclusive patent on semaglutide in the U.S. The drug company told us although Wegovy and Ozempic both contain semaglutide, they are different products, adding because of dosing they are not interchangeable and should not be used outside of their approved indications.
Wegovy and Ozempic, the breakthrough treatment for obesity, promises a fast result.
Weight loss patients have turned to the diabetes drug Ozempic amid shortages of Wegovy. Clint was unable to get the drugs made by Novo Nordisk, so his doctor prescribed semaglutide from a local compounding pharmacy.
Months later, after the event, I had started gaining weight again because I was not on the product, but I did do another dose. Within 24 hours, I felt the same level of depression all over again.
Clint shared his experience with the FDA through the agency's adverse event reporting system. We found 262 self-reported cases of depression and suicidal ideation for semaglutide products. That data includes reports of 20 completed suicides.
They feel strangely like kindred spirits who went through the same thing that I did, just didn't make it.
Whenever you talk about depression and suicide, we must take it seriously, and the FDA is taking a look at it.
Dr. Jane Morgan with Atlanta's Piedmont Healthcare says the FDA review of reports like Clint's shows the system is working.
And this is exactly how it's supposed to work. We don't leap to conclusions. We look for scientific data and evidence. You should absolutely speak with your physician if you're having any symptoms at all, and let she or he make a decision about what's the best course of therapy for you. you.
Novo Nordisk stands behind the safety and efficacy of all of our GLP-1 RA medicines when they are used as indicated, the drug company told us, adding, our review of the clinical trials, including large outcome studies and observational studies, did not find an association between the use of GLP-1 RA medicines and the occurrence of suicidal thoughts or actions.
I have zero doubt, no doubt that this drug caused me to be suicidal, and I almost lost my life from it.
So what should you do if you're taking semaglutide or similar drugs? The FDA says talk with your doctor. The agency is also asking medical professionals to monitor their patients for signs of depression and suicidal thoughts. If you or someone you love is having suicidal thoughts, you can get help right now by calling or texting 988. Again, the number for 24-hour suicide hotline is 988. A nationwide shortage of ADHD medication has been limiting the supply of Adderall since October of 2022. While the shortage's primary culprit was believed to be supply chain issues, a new study reveals another cause, an increase in diagnosis among women, with the number of women being diagnosed nearly doubling in the last few years. Rachel Polanski spoke with a doctor who believes telehealth during the pandemic played a large part.
I was so stressed out working 2 jobs and being a full-time grad student.
Miranda Johnson was 26 years old when she received her ADHD diagnosis.
And so I went through the whole process of getting referred to a psychologist, getting properly diagnosed, and then of course getting proper medication to treat it.
She felt a night and day difference. She could focus, pay attention to detail, and things were going well until October of 2022.
So that's when I started the phone game of calling multiple pharmacies.
Suddenly, pharmacies were running out of Adderall. The FDA even made a formal announcement that drug makers were unable to produce enough medication for those with ADHD. As a result, millions of patients, like Miranda, began facing refill delays at their pharmacies.
And so then I switched to another pharmacy, and then that one ran out, switched to another one. So I've gone through probably about 4 pharmacies.
While manufacturing disruptions were initially blamed for the shortage, a new study from JAMA Psychiatry revealed that prescriptions for ADHD medication have jumped by more than 14% since the start of the pandemic. So why the prescription surge? Dr. Subrat Bhargave believes that telehealth played a large part.
I think that there was some evaluations that perhaps were less than thorough that might have resulted in a person being prescribed medication that wasn't necessarily part of what they really needed.
While Dr. Bhargave says that overdiagnosing is taking place, he also believes that doctors have gotten better at diagnosing adults with ADHD.
And so for a long time, what physicians and other clinicians were looking out for in terms of symptoms, they were basing it on the ways in which a young boy might present, whereas a young girl who has ADHD may not look that way.
And so, he says the prescription surge, coupled with supply chain issues, has created a perfect storm. One that Miranda Johnson continues to battle each month as she walks from pharmacy to pharmacy.
It's kind of like luck of the draw every time you go.
Trying to get the medication she needs.
I hope it gets better, I really do.
Coming up, firefighters undoubtedly have one of the most dangerous jobs, but one of the most prevalent hazards isn't a fire, but their heart health. We explore why after the break. Welcome back to Investigate TV. Firefighting is one of the most dangerous jobs in the world. The job isn't just risky because of the burning buildings either. The National Fire Protection Association says the #1 killer of on-duty firefighters is sudden cardiac events like heart attacks. Some experts say these deaths are sometimes preventable. Kristen Crowley shows us how and gives us an in-depth look at the greatest threat facing America's heroes.
Our lives are measured in years.
We met January of 2000.
Timelines with weddings.
It was June 16th of 2001.
And babies. And eventually, the years stop.
50, it just turned 50.
2017 was Matthew Vonderfeck's last year. It was far too soon for his wife Rachel and their 3 young boys.
I feel like they missed out a lot that first year. I look back and wonder if they really had home here.
Did you ever worry about his safety as a firefighter?
Yeah, absolutely.
Rachel worried about the fires, that Matthew could get trapped in a burning building, fall through a roof or a floor. But that's not how he died.
I was on my way home from work a little after 4. My oldest son, Keegan, who was 10 at the time, used his dad's phone and took a picture and texted to me of his dad and said, Dad's cold and not breathing.
Matthew collapsed in his living room and died from a heart attack. No one saw it coming.
That never crossed my mind because he was still so young, and he took care of himself.
What Rachel didn't know at the time was the majority of firefighters killed on duty die from sudden cardiac events. The National Fire Protection Association's annual fatality and injury report found 38% of firefighter deaths in 2022 were due to just that. While Matthew was off duty at the time, his death was ruled in the line of duty because the department said his heart attack was a result of his work.
We know that there's much more to the hazards that firefighters experience than battling a fire.
That's Richard Campbell, the senior research analyst for the NFPA and the person behind its annual study. Campbell says cardiac deaths were the #1 cause of on-duty firefighter deaths for 42 of the last 45 years.
Why are cardiac events the #1 killer among firefighters?
Exposure to fire smoke, heat stress, noise, shift work, physical workload. They're carrying a lot of heavy stuff.
And it's likely for years, those deaths have been underestimated. Since the study began in 1977, it only counted those deaths if they happened while the firefighter was on duty. That includes during training exercises, when they're actively battling fires, or even when they're sleeping at the fire station. Now, it includes those who die within 24 hours of duty. In 2022, the first time that change went into effect, 16 firefighters fell into that category, bringing the total number to 36 who died from sudden cardiac events, the highest in the last 5 years. Campbell says the numbers are alarming because these deaths could be prevented.
Physical evaluations and fitness programs.
And preventing firefighter deaths is exactly what one company says it's determined to do.
We find a tremendous amount of cardiac disease.
Todd LeDuc is deputy CEO of LifeScan, a company that gives physicals tailor-made to first responders.
I'm gonna add a little bit of incline.
It's more involved than an average physical. It's an annual 3-hour exam that includes an EKG, blood work, stress test, mental health screening, and full body scan.
A significant number of the firefighters that we examine, on imaging, we see that the heart muscle is larger than a normal heart muscle. And we know that that's a precursor to sudden cardiac death in firefighters. A normal physical would miss that.
That early detection allows doctors to treat the ailment before it turns into something deadly. But it's not just heart issues the LifeScan physical is looking for. This is Stephen Epperson, assistant chief at Liberty Fire in Missouri.
13.
It's pretty intense little physical.
Stephen's taken it every year for the past 4 years. That first year likely saved his life.
I was back there doing my ultrasounds, and the tech she was going about her business, and she said, "Steve, you got a pretty large cyst on your kidney."
Further examination found much more than a cyst. It was stage 2 cancer. Stephen had his kidney removed, and now
I feel pretty good.
He's back on the force, cancer-free, and one of LifeScan's biggest advocates.
These things have been a lifesaver for several of us, mainly myself, and there's been some others that have cost some things too.
I'm going to listen to your heart first.
The NFPA recommends firefighters get annual physicals like life scans, but it's not mandatory.
So tell me how many cubes you see?
Even some departments that have signed up with LifeScan don't require firefighters to take the physical. Matthews Fire Department in Lincoln, Nebraska didn't have LifeScan or any similar type program, but Matthew had a checkup with his doctor just weeks before he died.
I know that our doctor felt terrible that she missed something, but I don't, you don't know.
Do you think if he had had more advanced looks at his health that maybe it could have been prevented?
I do.
Rachel doesn't blame anyone for what happened to her husband. Instead, she finds comfort knowing that what's being learned today could help families tomorrow, hoping they can continue measuring their life by the years instead of measuring it by the years lost.
Right now, LifeScan says it serves about 650 departments across the United States, and that number is growing. But these specialized physicals come at a cost. Liberty Fire says it spends anywhere from $540 to $640 a person, about $43,000 a year. LifeScan says the cost depends on the department's size and location. Scan the QR code on your screen now to watch full Investigate TV videos on our YouTube channel. While you're there, subscribe to stay up to date on the latest Investigate TV content. Up next, pilot's mental health in the spotlight after an off-duty pilot was arrested for allegedly trying to shut down a plane mid-flight. That story after the break. Welcome back to Investigate TV. Commercial pilots must obtain a medical certificate that covers both their mental and physical health. Without that certificate, they can't do their jobs. But a recent case involving an off-duty pilot who allegedly tried to shut down a plane mid-flight has raised concerns that some pilots may avoid reporting any problems with their mental health out of fear of being grounded. Ezra Kaplan in Portland dug into court records related to the case and spoke with medical professionals about the issue.
In order to sit in the cockpit and fly a commercial airliner, you have to be in really good shape.
Uniquely for pilots, unlike any other profession, we have a medical certificate that we have to maintain. And in my case, and in most pilots' case, it's every 6 months you have to go to an FAA-approved physician. And they go from top to bottom, not only the physical requirements needed to be an airline pilot, but also there's a requirement to evaluate mental fitness. And the way that's done is through a collaborative effort of full disclosure. You're obligated by law, and you can see the form you have to check off in a box.
That issue of full disclosure may be part of the case against Joseph Emerson, the pilot arrested earlier this week. When Emerson was interviewed by the FBI, he said that he had become depressed about 6 months earlier and had a nervous breakdown mid-flight. So why didn't he tell his employer about his struggles with mental health?
The evolving data suggest that a large population of pilots may participate in healthcare avoidance, and the story that is in the news about Alaska Airlines pilot may speak to the broader issue that is being supported in the medical literature about healthcare avoidance due to fear for certificate loss in pilots.
There is a common perception amongst pilots that if they report any sort of mental health issues, that they will lose their medical certificate and not be able to fly, even though only a few conditions like bipolar disorder and psychosis automatically disqualify a pilot.
And so this can result in many negative things, but one of them can be big financial disincentives. And so this paradigm can at times leave some pilots weighing the risks of stepping away or disclosing health information against the risks to their career. How bad does mild anxiety need to be for the potential walking away from flying for 6 months or longer?
But Dr. William Hoffman, who is a neurologist at the University of North Dakota and studies the brain health of flight crews, says that there are cultural factors at play as well.
Pilots are an extremely interesting patient population, and that's the reason that we take such an interest in researching this group. The type of person who is willing to be at 35,000 feet and have complete responsibility for 250 people over the North Atlantic, and at any moment be ready for an engine failure, a hydraulic failure, a medical emergency, and a bad weather storm, may not be the same type of skill set that will easily raise their hand and say, you know what, I think I might need to step away to get some help.
Dennis Tager is one of those rare breeds. He is a Boeing 737 captain and spokesperson for the union that represents over 15,000 pilots at American Airlines. He understands, like few do, the unique challenges of being a pilot. It's not just high stress, it's also a tough lifestyle.
The pilot profession is really a lonely profession. It's a rewarding profession, but you're out on the road a lot. It puts stress on family and personal things that other professions, many of them don't have. It's always been that way. We don't talk much about it, but we know internally that stress. Post-pandemic, our profession has changed.
Coming up, are you trying to repair or build your credit? We share tips to help you start after the break. Welcome back to Investigate TV. If you're newer to building credit or don't have an established credit history, secured credit cards may be a way to get started. Rachel DePompa talks to an expert about how they work in this week's Watching Your Wallet.
According to a new NerdWallet study, 14% of Americans say a roadblock for them when they're trying to improve their credit score is not being able to be approved for a credit card. If you have bad credit and you're trying to repair it, or maybe you're new to credit and trying to build it, Sarah Rathner, a personal finance expert with NerdWallet, says you could consider a secured credit card.
With this type of card, you make a cash deposit up front, and that becomes your credit limit. And over time, with thoughtful use, you might be able to graduate to an unsecured credit card, which is the more traditional credit card we're used to.
A secured credit card is often easier to obtain because it's backed by the cash deposit, so it's less risky for the creditor. Rathner also says don't beat yourself up if your credit score has taken a hit.
It is really easy to let this 3-digit number, your credit score, make you feel like you are worthy or not worthy as a person, and that's not true. All it is a snapshot of one piece of your overall financial picture. It's not your character.
She says as you make changes in your life to rebuild your credit or establish your credit for the first time, again, don't beat yourself up if it's a slow process. Keep tackling it one step at a time. And she says if you can't do anything right now to improve your credit, that's okay too.
And that's it for us. Thanks for joining us here on Investigate TV. Hope to see you next week.